my name is Ivan. I'm a phlebotomy student here at Ames, and my body presentation today is about the urinary tract system. So my presentation will start from the beginning to the end, and pretty much everything that goes in through the middle of what creates urine and how urine works and how the urinary system works in order to purify the blood and also get rid of toxins, and how it goes to the cardiovascular system and the lymphatic system. So a lot of your fluids will begin through the oral cavity, make its way down through the esophagus, into the stomach. Then after that, once it passes through the stomach, it goes into the small intestines. Then it makes its way through the cardiovascular system. As you see here, this is the cardiovascular system, where fluids or water, H2O, will travel through the entire body in order to keep it cool. Pretty much lubricate it, keep it working and all that stuff. So pretty much the cardiovascular system feeds into the muscular system. As fluids go through the cardiovascular system, make its way into the muscular system, as represented here, it pretty much helps keep the body cool and also helps move the toxins through the body system back into the cardiovascular system, which makes its way also through the lymphatic system. As fluids also flow through the lymphatic system back into the cardiovascular system. Now we come to the urinary system, where blood will flow into the kidneys, pretty much getting purified. And the kidneys, the way they work is pretty much they will purify the blood and remove the toxins, the waste, and that waste becomes pretty much urine, which will make its way down through the ureters into the bladder. Then from the bladder, once it fills up, pretty much the bladder will send a signal to the brain, and the brain will pretty much tell you it's time to pee, which will make its way out through the urethra, which is in the bottom. So pretty much kidneys, ureters, bladder, urethra, and then you end up peeing. In a lot of hospital settings, strip tests are commonly done to pretty much to detect toxins, drugs, infections, pretty much ranging from diabetes to dysuria. I hope I'm pronouncing that correctly. Pretty much to detect if there's a problem with the urinary system, or if not, if there's any underlying further problems with your health. A lot of urinary tract infections pretty much consist of sciatis, which is infection in the bladder causing pain, frequent and urgent urination. There's urethritis, pretty much infection of the urethra. And then there's pyelonephritis, which is kidney infection caused by spreading bacteria. Urinary retention, the inability to empty the bladder completely, which can be acute, sudden, severe, or chronic. Structural and pain conditions is pretty much intestinal sciatis, a chronic condition causing the bladder pain and pressure. Bladder stones, hardened minerals that develop into the bladder. Also kidney stones, which pretty much too much sugar into the kidneys. Those are pretty painful. Never had them, but I see a lot of people that I've met say they hurt. There's also large prostate, commonly cause a slow, weak, and interrupted urine stream in men. And there's also bladder cancer, often identified by blood in the urine. A lot of management and treatment for a lot of this stuff is like for women, they do exercises such as Kegel exercises to strengthen pelvic floor muscle. There's also physical therapy, there's medication, pretty much to treat infections. or reduce bladder spasms. And in worst case scenarios, there's surgery procedures. So the conclusion of my presentation is basically, if you started noticing any differences in your urinating patterns, for example, you're urinating too much, or there's a smell to your urine, or if it's coming out too foamy, seek medical help. Go to your doctor, set up an appointment. Pretty much a lot of people that urinate a lot are signs of diabetes, or if not, when it's coming out too foamy, it could be a sign of you're losing too many proteins or going into ketosis. If not, like for example, like I just mentioned, if you start noticing blood in your urine, pretty much anything that comes out as abnormal or out of routine of your regular routine when you're urinating, just go seek help. Get that taken care of, and make sure we all stay healthy out there.